the sacrum, they're supposed to have the arch. They're supposed to have the curve and the arch. But sometimes what's happened, the coccyx, the tailbone, some of them has a very little in, they're more out. Once you're out onto their coccyx and tailbone, they're having a difficulties on doing core exercise. And this happened due to, again, can be long torso, may not be. We have another example over here, the woman with the glass looking backwards.
Look
And
from
ask
look.
her to demonstrate later on, see her touch here, you can see pokey bones coming out. Again, these are things can be cured through back bend. Today what you seen her after you touch her, and 5 years back what I seen her is different story. Last time, see wear a pant, something maybe poking out. Like something you put inside, it's poking out. Yes, can see.
Can feel
Yeah.
it.
You also may have it poking. So, but after doing several back bend, which is bridge pose and all other pose, it's go in despite of how old are you. It changes. It just take a time, be patient. Don't give yourself time. 2 years down the road, or 200 personal training, I do know. Is as you practice, you get it. There's no measurement of it. The way you work on it. All right. I'm moving into here. Okay. Can you see this part of the body? Can you see the hole? Can you see the hole go through? Yeah, where the spinal cords are. The spinal cords are. The spinal cords are very protected inside, very protected inside. Because whatever happening, the spinal cords, I will draw you later on the board, how the spinal cords stay. Do you know our brain are being floating inside the spinal cord? So the spinal cord is such a way, if I'm drawing something over here, this is the brain and goes down to the spine. So inside has a fluid and the nerves coming down, and every vertebra, in between the vertebra, the nerves are coming out in a crisscross position. So the fluid are increased based on our practice and decrease based on our practice. So the more practice of yoga asana you do, the more bend your spine you do, more you increase the fluid into your spinal cord. Now over here, that's why you call anti-aging. When you do back bending, it's called as anti-aging of your. So there's the hole where spinal cord stay there, and this is the first cervical vertebra, which is called atlas. And the shape of your atlas are very different compared to other cervical vertebra into your body. Let me move it around. You can see the shape of the first vertebra and second vertebra are very different compared to the third vertebra, fourth vertebra, and all others. So these are all the same looks. The first one are very different because they are the one taking a support of your cranium. So if you see on the top of the vertebra, if I make it all 360 degrees up, then you see, this is where, this is where the shape of the atlas, I call it atlas. Okay, the shape on the top, these two area, or your cranium is sitting down on the top. That's where the shape of it. So the first vertebra is not movable because they move with the head. The fragile is very little. If you look at the second vertebra axis, which as well are not the same shape, because the second vertebra which giving you a support of your first vertebra. From the third vertebra of your cervical, which the shapes are same all the way to lumbar. Now if you notice one more thing, as you go down, the gap between vertebra get more and more. Basically the gap more into the lumbar region. If you look at it, the gap in your vertebra are more into your lumbar region. If you see lumbar to thoracic to cervical, the more higher you go, more lesser gap you get it, or lower you get. Okay. Next, I'm going to go on your pelvis. Okay, let's look at the pelvis. I'll not explain much. I have a video for you to show you in the pelvis over here. But just to show you a few points, and then I want to bring into the different bone structure. If you look at over here, the rim of the pelvis, which is the left and the right, generally most of the time we have noticed those who do the dissection of their bodies, most of the time left and the right pelvis are not balanced. Most of the time, every human being, left and the right pelvis not balanced. When you talk about not balance, there's two different sector of not balancing. Not balancing means either your left sacrum is higher than the right, or left are rotated forward than the right. So there's two way. One is this up and down, or one is this up and down. These two movements of unevenness are very common in the human body. But again, is how much. The more you rotate it inwards, that's cause difficulties for you. But if you have a minor movement into your hips, that's fine. Doesn't give any tingling sensation unless you go deep into the posture, deep into the forward bend, deep into the binding, deep into the backward bend. That's give. I have seen that when I teach advanced classes, some students, when they do deep back bend, after that they have a pain on the right side or left side, the sacral joint just over here. You see the sacral joints? There is the left and there is the right. So those who really deep go inside it, into the back bend poses, and if they happen to feel on one side of the sacral joints pain, this is straight away reflect that side of their back are weaker, or they're getting over compression into the joints. And secondly, the pelvis, that side of the pelvis are much rotated inwards compared to other side. So if you guys did any back bend poses, deep back bend poses, or even mild back bend, what you did with the cushion, coming down, students say, after that I feel one side pain, means you need to know their pelvis are not balanced. They have one-sided rotate inwards or one-sided upwards. The side you upwards, you get compression faster. Okay? And that is the looks. This is the hip bone we call, these two part. And most of the muscles are connected over here, like we talk about the hamstring. Most of the lower body muscles started from this area. And this is the hip socket where your femur bone goes in. This is the socket or your acetabular we call. The head of the femur go inside. There's a two area over here. One is, if you see, one is very smooth area. One is pretty rough inside. The smooth area which mobilize, and the rough part where your ligaments are connected. Okay, ligaments are connected to bone. Okay. This is the SI joints, which most of the time people get a compression, degeneration, and all the problem happening is over here. From here, L5S1 we call. And this is the part where we get a compression and degeneration into the back. So most of the time, try to think simple. Is think always within your boundary. Any problem come to you, remember it's a compression. Close eye, just a compression. Just make it easier. Yes, trust me, compression. Because if you think too much, you get confused. You cannot analyze what exactly happened to you. First thing, any problem happens, you accept the fact first. Okay? Then start the treatment. And then you see the reaction come to you. And then you go for the second conclusion, third conclusion. Anything happen in the spine, anything happen around your back, shoulder, neck, all the joints, all compression. Okay? If certain percentage not compression, what do? Consult with your expert, teacher, or somebody else. That I presume that this is an compression, but it was somehow not a compression. I did what I supposed to do, but it's not helping. So what I going to do somehow? Can you close the door? Yes, please close the door. I think the cleaner talking outside. And majority of the time, the joints are affected due to the compression only. Okay, we'll not spend much time here. I'll be go into your lumbus a little. Yep. Okay. This is the lumbar vertebrae. I'm going to show you on the top, from the top. Vertebrae. Okay, the part I want to highlight over here is just now spoken with the spinal, what is called spinal cord. So if you notice the cervical and the lumbar, once it goes down, the gap between your vertebrae, the gap over get narrower for the spinal cord. So the spinal cord come down in this shape as it goes down narrow, 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 narrow until L2, and thereafter it's like a bag. Okay, it's like a bag goes down in L2, close the bag, and then goes down to the coccyx and the tailbone. It's somewhere the gap end in the L2, L3, L4 maximum. Majority of us in L2. So the fluids, and thereafter the bag get closed. And when you talk about waking up your kundalini, this is a very common word. Your energy, bring it up. This is all about from your pelvis energy, push through and open up the back and bring your energy up into your spinal cord and through all the brain, because this is the spinal cord which is get open up as it go up and then go into the brain. The brain is here, is go up, open it up and goes down. I want to show you later on also. I have some images on that. Next, cervical spine. When you talk about the cervical, in practice, nothing much to be explained in the cervical, but being a yoga practitioner, you'll be always facing student come with saying, I got a neck pain. When it's neck pain, try not to make them do forward bending, which is shoulder stand, plow. Again, it's very hard for teachers to make students create traction onto the neck. Backward bending, say feel pain. So you need to measure this pain is a contraction pain, compression pain, or stretching pain. For student, all kind of pain equal to pain. All pain equal to pain. Okay, stretching pain, contraction pain, compression pain. They don't know how to separate the feeling. They just know this is called pain. Okay. So any kind of cervical pains once they feel is all about back bend. Now the pain is based on their individual endurance level. Those who never done exercise don't like to feel pain, don't like to do exercise. To them, they feel pain means not pain. Take it as a stretch. So once you ask them to do forward bending, if you see they are not reaching towards the toes, they're finding excuse to coming back. Means this other body, psychologically, they are not accepting the pain. So if they say backward bending pain means not the pain, it's a stretch. But when you're seeing a personality who try to go deeper and pushing, when they feel the pain, that is a compression pain. So you have to identify on the neck area, when a student say pain, is it really pain or not? You don't just take it as a pain. You make the student do some poses and see the limitation, how the attitude towards the practice, and then the pain will give you a right answer. Is it a pain or not a pain? So you need to be decide as a teacher what exactly I need to do. If the student say pain, I take it, oh, it's a pain, take it easy. I can't help my student actually, because it's not a pain, it's a stretch. So when the student never drop the heads back, once they bring the heads back, they say, oh, I feel pain. Straight away they feel pain, because they never bring the heads backwards. Over here, I'm going to play a video right now. And this video, I'm going to play once, I'm going to play a few rounds. I have 2 or 3 videos. Pay attention here, okay? Yeah, I'm going to come back with it later. So let me find it.
Femur is the longest bone in the body. We'll be looking at its distal end in the next section. For now, let's look at the features of the proximal end. This is the head of the femur. This is the neck. Since the head is wide and the neck is narrow, the head of the femur can go a long way in this axis.
Just imagine if the neck of the femur is shorter, where when you're rotating your femur bone, it will be hit faster. Certain time, our legs rotation in the different direction is also impacted based on the size of your greater trochanter and the lesser trochanter.
In this axis, before bone hits bone.
So over here, I move it back again and you see.
And in this axis, before bone hits bone.
So once you have the femur neck is shorter, you'll be hitting faster. If you have a long femur, your greater trochanter will not be hit so fast. So certain time when you're raising the legs up in a direction is not only about your flexibility, it's the shape of your bones you have. That's also limit. Most of the time students are not aware of that, and they can, and I'm not saying that you have that. I'm not saying you have that until I bring you to dissection after you die, then only I know. Then only we know that hey, you can't do because you had this. So until then we don't know, but this could be one of the reasons. But don't give excuse that oh, because I have that I can't do it. I don't want to stretch, you know. So that's how the students say, oh, I cannot do because I have that. And once you have that, you will have limitation both sides, not one side. If you have one side means it cannot be one side of your femur neck is longer, one side femur neck is shorter. We have not seen that. Okay, have to both sides.
The pelvis and the two femurs. We'll look at the pelvis by itself. The pelvis is made up of the two hip bones, or innominate bones, and the sacrum. The fibrous joints which unite them, the two sacroiliac joints behind, and the pubic symphysis in front, permit almost no movement. We look at the right hip bone by itself. The hip bone is formed by the fusion of three bones: the ilium, the ischium, and the pubis. The names of these bones give rise to the names of the various features of the hip bone. Let's look at these features. This broad bony plate is the wing or ala of the ilium. Its broad roughened edge is the iliac crest, an area where many important muscles attach. The iliac crest ends in front of the anterior superior iliac spine, and behind at the posterior superior iliac spine. This is the ischial spine, with the greater sciatic notch above it, and the lesser sciatic notch below it. This is the ischial tuberosity. The ischial tuberosity is another area where many muscles attach. It's also the part of the hip bone that we sit on. The socket for the hip joint is called the acetabulum. This broad, smooth area is the articular surface. We'll see it again in a minute with the articular cartilage intact. The big hole in the lower part of the hip bone is the obturator foramen. This is the body of the pubis, this is the superior ramus of the pubis, and this is the ischiopubic ramus. This prominence is the pubic tubercle to which the inguinal ligament is attached. It's helpful to keep in mind that the upper part and the lower part of the hip bone face in different directions, like my hands. So when we look at the hip bone from in front, like this, we see the inner aspect of the ilium and the outer aspect of the pubis and ischium. Now that we've looked at the hip bone, let's bring the sacrum back into the picture. We're looking at the bones as they be in the upright standing position, and it's perhaps surprising to see the angle at which the sacrum lies. Its pelvic surface is more nearly horizontal than vertical. The sacrum is attached to the hip bone not only by the sacroiliac joint, seen here from behind, but also by two big ligaments, one going to the ischial spine and one going to the ischial tuberosity.
The ligaments video I'm going to show you next week.
The pelvis is made up of the two hip bones, or innominate bones, and the sacrum. The fibrous joints which unite them, the two sacroiliac joints behind, and the pubic symphysis in front, permit almost no movement. We look at the right hip bone by itself. The hip bone is formed by the fusion of three bones: the ilium, the ischium, and the pubis. The names of these bones give rise to the names of the various features of the hip bone. Let's look at these features. This broad bony plate is the wing or ala of the ilium. Its broad roughened edge is the iliac crest, an area where many important muscles attach. The iliac crest ends in front of the anterior superior iliac spine, and behind at the posterior superior iliac spine. This is the ischial spine, with the greater sciatic notch above it, and the lesser sciatic notch below it. This is the ischial tuberosity. The ischial tuberosity is another area where many muscles attach. It's also the part of the hip bone that we sit on. The socket for the hip joint is called the acetabulum. This broad, smooth area is the articular surface. We'll see it again in a minute with the articular cartilage intact. The deep hole in the lower part of the hip bone is the obturator foramen. This is the body of the pubis. This is the superior ramus of the pubis. And this is the ischiopubic ramus. This prominence is the pubic tubercle to which the inguinal ligament is attached. It's helpful to keep in mind that the upper part and the lower part of the hip bone face in different directions, like my hands. So when we look at the hip bone from in front, like this, we see the inner aspect of the ilium and the outer aspect of the pubis and ischium. Now that we've looked at the hip bone, let's bring the sacrum back into the picture. We're looking at the bones as they'd be in the upright standing position, and it's perhaps surprising to see the angle at which the sacrum lies. Its pelvic surface is more nearly horizontal than vertical. The sacrum is attached to the hip bone not only by the sacroiliac joint, seen here from behind, but also by two big ligaments, one going to the ischial spine and one going to the ischial tuberosity, as we'll see in a minute.